rotators and lateral flexors. So the muscles, even though whenever we are doing rotation movement, always it is the mixture of the lateral flexion. Always a kind of lateral flexion will happen in the rotation. So that's why we will see always in vertebral column lateral flexion and rotation will see together. So the muscles which are going to provide rotation in the anterior abdominal wall. In the anterior abdominal wall means external oblique aponeurosis, internal oblique aponeurosis. So these two muscles are going to produce the rotation and lateral flexion. Suppose we are taking one patient here. Okay, this is our vertebral column. Imagine, so this is the abdominal area. This is the abdominal area. Imagine we are seeing anteriorly. This is our chest muscle. Okay, this is our chest muscle. Okay, now we'll see. So if the patient is like this, imagine this is our right side, this is our left side. So if the patient is doing left side rotation, what will happen means, if the patient is doing left side rotation, right side external oblique aponeurosis muscle has to work. At the same time, left side internal oblique aponeurosis muscle has to work. Then only left side rotation will happen. Understand the point? So if the person is doing left side rotation, that time opposite side, if the person is doing left side rotation, right side external oblique aponeurosis muscle will work and left side internal oblique aponeurosis muscle will work, so that patient will get the rotation movement. So if the patient is rotating to right side, it is opposite. If the patient is rotating to right side, so that time left side external oblique aponeurosis has to work, right side internal oblique aponeurosis muscle has to work. Okay, and one more special point means, here in our body we will be having posterior muscles. Okay, posterior muscles of the vertebral column. These muscles are going to produce the rotation and lateral flexion. So these posterior muscles are going to divide into two parts. First one, what is this means? Rotation and lateral flexion will be done by the same side. Second one, rotation, lateral flexion will be done by the opposite side. What it means? Suppose if we take vertebral column posteriorly, so here few muscles will be there, So what is this rotation, lateral flexion, same side means? Suppose this is our left side, no, this is right side. If these muscles are going to helpful for the left side rotation and lateral flexion, then we can say these muscles are rotators and lateral flexors on the same side. Suppose here I am drawing one more group of muscles on left side, If the patient is doing right side rotation and lateral flexion, if left side muscles are helping, then we can say rotators and lateral flexors for the opposite side. So these muscles are going to helpful for the rotation, lateral flexion of the opposite side. So that's the two types here. So we'll see which muscles will comes under same side rotation and lateral flexion, which muscles will comes under rotation, lateral flexion on the opposite side. So the rotation and lateral flexion of the same side muscles, those muscles are, just I write the names. So those muscles are iliocostalis. This is the one muscle, and second muscle longissimus muscle, and third muscle longissimus spinalis muscle, and here one more muscle quadratus lumborum. This is the posterior abdominal wall muscle, quadratus lumborum muscle. Here we know the main function of this muscle is lateral flexion and rotation. So quadratus lumborum muscle. So these are the three most common muscles which are going to produce the same side lateral flexion and rotation. Now we'll see the muscles which are going to produce the opposite side opposite side rotation and lateral flexion movements. So those muscles are the semispinalis thoracis, and multifidus is very important muscle. And one more muscle is there, intertransversary thoracis. So these are the three main muscles which are going to produce the rotation and lateral flexion on the opposite side. This is a very nice point about rotators and lateral flexors. So rotators, we know that usually it is produced by the quadratus lumborum muscle. This is the number one muscle, and second one iliopsoas muscle. So these are the posterior abdominal wall. So if you see anterior abdominal wall, we discussed external oblique aponeurosis, internal oblique aponeurosis, transverse abdominis, rectus abdominis, cremaster, and pyramidalis. So these are the anterior abdominal wall muscles. If you see posterior abdominal wall muscles, here we will be having iliacus muscle, psoas major muscle, psoas minor muscle, then quadratus lumborum. So these three muscles together, iliacus, psoas major, psoas minor, together will tell iliosoas. So that finally the rotator and lateral flexion will be happened by the posterior abdominal wall muscles. Okay, now we'll see. So here we are seeing now, this is our quadratus lumborum muscle. So from lower ribcage to the iliac, this is our iliac crus. So it will be here, the muscle will be present here, and we know where the psoas muscle will be there. So from T12 to L1, L2, L3, L4, L5. So from here the muscle will come from T12 to the up to L5. T12 to L5 transverse process, and it will insert into the lesser trochanter of the femur. This is the insertion of this muscle. So these two muscles are going to helpful for the lateral flexion and rotation. Suppose here two cases we'll see. Okay, two cases. First one here thorax is fixed. Second one, pelvic is fixed. So what is thorax is fixed means, suppose if the thoracic spine is stable, someone is holding thoracic spine like this, okay, ribcage someone is holding. So that time if the quadratus lumborum muscle is contract, what it will do, contraction means it will do like this, contraction from insertion to the origin, it will act like this contraction, that is nothing but concentric contraction, shortening. So that time what will happen, this contraction of this quadratus lumborum is going to pull the pelvis upward. Then if the thorax is stable, if the thorax is fixed, suppose if the pelvis is fixed, someone is fixed the pelvis, otherwise in standing position pelvis is fixed. So that time if the pelvis is fixed, that time if it is going to contract like this, what will happen, it is going to create the lateral flexion, so if it is contract when the pelvis is fixed, so that time the upper thoracic segment, because of this contraction, it will move to this side, that is lateral flexion. And here one more point, suppose if this is right side, no, this is right side, this is left side, if the person is doing right side lateral flexion, the muscles which are all, so if the person is doing right side lateral flexion, the muscles which are all present on the right side will go for the shortening contraction, concentric contraction, so that to prevent further lateral flexion, here the muscles which are present here, this side quadratus lumborum muscle will be there, at the same time external oblique aponeurosis, internal oblique aponeurosis, iliopsoas muscles, all the muscles which are all present here, these muscles length will increase, this side muscles length will increase. So here concentric contraction, here eccentric contraction of the muscle, is going to prevent the further lateral flexion, because here the muscle length is increasing. If the muscle at certain point of time the muscle length will stop, it will not go for further lengthening, so here lateral side bending will be stopped. So this is about the rotators and lateral flexors of the spine. Clear?